All right, well, Lilah's surgery is this next week, so I just thought we would do an overview or recap of what we've been dealing with. When she was 9 months old, I previously said 6, but I've been thinking about the timeline, and I'm pretty sure it's around 9 months old because we were in the middle of our training session and we started that in January to May. So I believe it was in March when the issue started, and she would have been around 9 months old. But it was this leg here, and our vet at the time decided to start, of course, conservative process, and we did carprofen or carprovet and rest for 10 days, and it was not improved. So then we added red light therapy to it, and we did that for an additional 3 weeks, and including the carprovet and the rest. And then it still hadn't improved, so he suggested we go to MU, Missouri, University of Missouri, and their vet specialty. But before I started making those 3 or 4 hour trips to deal with that, I decided to get a second opinion at another local vet. And I found one that had history of orthopedic surgeon experience. So I went there, and he looked at it, and he did more x-rays and different angles, and he didn't see anything or any reason for it. So he suggested before I go to MU, we try just an antibiotic and see what happened. So we did an antibiotic for 10 days, and her limp actually improved, but it wasn't gone. So then we did another round of antibiotics, and it went away. So I don't know if it was just timing, because at this point it had been like 3 months or more since the issue started. So I don't know if the timing of it was just it went away, or if it was actually the antibiotics that improved the situation. But as a preventative measure, because of his orthopedic experience and these bigger dogs tending to have joint issues, when we first went to the second vet and he did the x-rays, I asked him just to do extra x-rays of her hips and elbows and things so I would know if she had hip dysplasia or any other joint issues. And it turns out she did have hip dysplasia. So the limp was gone. It would still come back occasionally, like every 2-3 months, not very often. If she was outside running and playing and acting a fool a lot, I would give her a pain medicine once, and then it was gone and she was good. Up until I think it was July of last year, she developed a limp again, and it was not going away. Consulted with our vet, and she took some more x-rays. This girl's been x-rayed I don't know how many times at this point, but she took a look at it, and she could see it wasn't quite right. It looked like there might be some arthritis or something in there. And she had recently taken her older dog to an orthopedic surgeon in Kansas City. So she suggested that I go and have a consult and see what he says about Lilah's elbow there. Like I said, originally we thought the issue was her wrist. So this was kind of a surprise that she was now having an elbow issue. But we made an appointment with our orthopedic surgeon, I think it was last September, and that's when we discovered her elbow issues, that the growth plates did not close correctly, and that the bone that goes from her elbow to her wrist is actually a little short, so it doesn't sit in the joint correctly. So he developed a plan to do a surgery to correct all of that. And it took a little bit to get the money together to do that, and we did it, and then that was scheduled for the end of January, but because of the winter storm that came across the USA, we rescheduled it for the soonest they could do was this next Wednesday. In between the end of February and now, I noticed that Lilah was licking that front wrist a lot. You can see there's kind of a callus on that and that black spot on her there. And so my concern was, if that now was causing her pain or something else going on with that. So I contacted the orthopedic surgeon about doing that, and that was the consult we had this last week. And he confirmed that it is just an extra bone growth. For whatever reason, the bone decided to keep growing out to the side a little bit. It's probably almost like the top of my finger. That's how long, almost, that length that it grows out. And it's actually not in the joint, it's above the joint. But it is causing some skin issues with the scar tissue or callus type thing growing off to the side. So that is what we were doing, is considering having that shaved down. He said, he's never done anything like this as far as what will happen afterwards. And there, of course, are no case studies kind of things that he's aware of. And there's a possibility the bone could just grow back in less than 3 months. But with it being off to the side and it not going to, there aren't two bones for the body to fuse back together. Like if you break your leg or break a bone, there's two pieces that need to be fused back together, and your body will automatically correct that. Whereas this is just an extra piece of bone that kind of sticks off to the side above the joint, and there's nothing for it to try to repair or fuse back together. So we are deciding on that right now, whether or not we want to try that. The pros or cons, he couldn't guarantee anything, anyway, positive or negative, anything about that. So that's what we're thinking about. And that's what this week's appointment was. He said the joint, it's above the joint, so it shouldn't be causing any joint issues or pains or anything. The licking, he said, just possibly could be because the skin was irritating her or something, because that callus thing, it actually started almost all the way back when she was 9 months old, and we were going through the process of trying to figure out why she had that limp that was not going away. And then it developed that callus or scar tissue, and nobody knew why that was there either. So it could be that it just got big enough because it has continued to grow and get bigger. It was basically looked like a pad on the bottom of her foot. It was kind of rough, and it was, that texture and that color and everything. So it could be that it just grew big enough that it was kind of irritating her, and she was licking it, and then it happened. She was licking it so much that it completely went away. But then now it is. I was giving her meloxicam pain medicine for every day for 2 or 3 weeks, and then I quit just a couple of days ago, or a couple of days before we went to the surgeon to see if she would improve or if she started licking again, or if she had left it alone, because she had gotten to the point with the meloxicam that she was leaving it alone. But it has started to grow back already, the scar tissue. So it is something we are considering. We don't have to let them know until the day of surgery. So that's what we're thinking on right now. But we are proceeding, of course, with our elbow surgery. He said whatever we do with that extra bone growth won't affect her elbow surgery or the recovery process. But yeah, then if you have any advice or tips or tricks on what may have helped you with a similar surgery on the elbow, orthopedic type recovery process, leave those in the comments. But yeah, just thought it's easier to just talk about it than type it all out. So I just thought I'd give you a quick update, and we hope you have a great day. Thank you. Bear hugs.